Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor who sees headache patients often, as well as the author of a book on migraines and epilepsy. This particular study just typifies how we treat migraines in neurology, primary care today. And before we get started, make sure you like this video, share it with somebody who you think needs information or has migraine headaches, and subscribe to the channel. But the latest, coolest drugs on the market are the calcitonin gene receptor protein antagonists, so CGRP, and it's the whole, hey, this is it, we've found the drug that causes migraines, or the product, or the cause of migraines, and it's absolutely not true. It's just another marker or another pathway of pain generation in the brain. We ideally want to, stop the pain from being generated in the first place, but that's never a discussion. We want that med that's a home run, and it's going to provide wonderful options and make the drug companies lots of money. So the latest in this path is Ubrevely, and it was approved in December 19, so it's been out for a couple years. This is another study looking at what could we do. So if people have they identified patients with prodromes, so auras. There's a list of things that could be considered prodrome. It can be neck pain, it could be an aura, it could be sensory, it could be visual, but the people in the study had to identify the prodrome, and they had to either take the placebo one time around and then the Ubrevely the second time, or the reverse. They take the med the first time and the placebo the second time. And so there were 477 people in the study, and here's the bottom line. They were looking at a couple different things. First of all, any activity limitation, or was the patient able to function normally, whether taking the placebo or taking the drug. Now, a couple things that are important to know is that, first of all, this drug costs around $1,000 a month. And even if you have insurance that covers it, the thing we need to remember that somebody is paying $1,000 per month. If your insurance covers it, everybody else that pays insurance is covering that. It's not free. It's an expensive drug. And so 75% of the people in the study had limitations prior to their headache. In other words, there's things wrong, and that's my contention, is that the brain is not happy. It's not a problem in the brain. The brain is not happy with the rest of the body's overall health, and that's why lifestyle becomes such an important component of migraines. But 75% of the people had limitations even before their headache hit. So what did the drug do for $1,000 a month? I suggest you go into the study and look at the graphs, and it's just not dramatic. First of all, there's a pretty strong placebo response of all. But the difference between the placebo and the drug is really pretty small, ranges from anywhere from 11 to 18%. That really kind of sucks for $1,000 a month for a drug that's it's not fixing the problem, it's just addressing a pain pathway. So I would suggest, what if we put together a cocktail of like coenzyme Q10, magnesium, melatonin, and fish oil, all things that have been shown to help with both preventative and migraine severity and frequency, and put it in a cocktail and spent maybe $100 a month. That's at the high end, but we're actually looking at fixing some of the problem. And then we compare, there's no doubt that any one of those drugs probably is equivalent. The combination of all of them would most likely knock it out of the park. And that's not even considering things like exercise and metabolic health, so improving your lifestyle to make you less pre-diabetic, less cardiovascular disease risk. The bottom line is we have these new drugs, and they're all kind of fancy and shiny. They really kind of suck in the studies at how much they help improve. It's a little bit, but the placebo was holding out pretty well in this trial, which we see. But there's always downsides with these drugs and the expense with these drugs. But the bottom line is we're not fixing the problem. The CGRP pathway is not the problem. It's activated but it's not what started it in the first place. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.